Hey everybody, how we doing? This is Dr. James Deom at Hazleton Eye Specialists and Stroudsburg Eye Specialists. Here today with my lovely wife and beautiful daughter, Brynn. Very excited to have this episode of Eyecare today featuring my two favorite ladies in the world. And talk a little bit about infant and vision development and infant and vision eye care. So, you know, we are not sure how Brynn's going to do here today, but she's been on the camera a couple times, so we'll see how it goes. And I think this, you know, hopefully should make all of you feel really comfortable about bringing your infant here to Hazleton Eye Specialists to let us take good care of them. So really today what we're talking about is the InfantSEE Program. And InfantSEE is a program that is sponsored by the American Optometric Association. And the purpose of the InfantSEE program is to get infants in to have a comprehensive eye exam sometime between the ages of 6 months and 1 year of age. This is a very important time in infants' development, and we want to be able to make sure that we can intercede. So we want to talk to you today about the importance of vision development in infants, and we also want to talk to you about how great and easy and simple a comprehensive eye exam done by an optometrist is, and what are some of the things that we're looking for. So we're going to jump right in to infant vision development. So you can see here Brynn's getting a little antsy, and that's totally fine. We totally expect that. So when Brynn was born, what were some of the things that you remember about her vision?
Well, I remember her opening her eyes, kind of being drawn to bright lights, fast-moving objects.
Right. Yeah, great. And that's one of the things that we hear a lot is, you know, gee, you know, I'm not really seeing them follow me or anything in particular, but it seems like bright lights are really drawn to bright lights. And I remember we would even joke around that Brynn was like a little bug, you know, because she was looking at the lights, and that seemed to be really interesting to her. And the good news is for all of you that, you know, when the child is born, the first, you know, couple days and weeks and even first couple of months of life, you know, that what type of vision they have is quite low. Their vision is not 20/20 like ours. So it does take some time for them to develop their vision. It might go from 2100, 2050 to 2020 in the first couple of months of life. So it does take some time. And bright lights are one of the things that's going to stimulate their vision. So allowing them to look at lights and stimulating them with a bright light on one side or the other is actually a wonderful thing to do to stimulate their vision. That's one of the things we did with Brynn, was give her some bright lights on one side or the other. And watch her kind of move her eyes to them and just kind of let her practice her eye movements and the way it is that they work together. One of the things that I know we talked about too was early on, it didn't seem like her eyes were working together as a team. And that's very common in the first couple months of life for us to not notice those things. As time goes on, as we enter into the really 2-3 month phase, we're starting to notice that their eyes are working together a little bit better as a team, and that they're going to actually at that time start to develop their dimensionality, their ability to see in 3D. So that's something that really starts around the 3-4 month phase, and then starts to develop really until they're one, actually. This is one of the last things to develop. So that's one of the things that you'll also see, is that as time goes on, they will develop that phase. Another thing you're going to want to look for in the early months is their ability to grasp and reach, and accurately. You're not going to see a very accurate grasp and reach in those early couple months. That's going to be something that's going to develop more in the 4 months and on phase. And my wife is actually a physical therapist, so one of the things that I know we also look for are some basic reflexes, right? So some basic reflexes that we know about in children are rooting reflex, right? So when you place a bottle near their mouth, that they're going to go ahead and suck on that. The grasping reflex, that's one that we're going to be looking for. When you place something in their hand, they're going to actually go ahead and grasp. That's a normal reflex to look for. Another reflex that we often look for is when we present something on one side of their body and tilt their head to that side, that they're going to actually put their arm out and bend their other arm. This is a very important reflex that we see in the 2, 3, 4 month phase of life. That's allowing them to develop their laterality. This is an important part of developing vision, and also their ability to see on both sides. So these basic reflexes, while it may not seem like they're very important, are a big part of their ability to see. So we know in these early phases that their vision is just developing. They're not seeing 20/20 yet. Their eyes are generally farsighted and go through a process of development from farsighted to no prescription, and then sometimes on beyond that. So this is normal development. 3D vision is starting to develop, but is not quite there yet, around 4 months of age. So we're up to the 6 month of age point, where we're starting to really get our ability to see in 3 dimensions and our ability to see at a higher visual acuity. And this is the time we want to come into the optometrist's office to get a comprehensive eye exam. So after the break, we're going to talk all about InfantSEE comprehensive eye examination. Welcome back to Eyecare Today. I'm here with my wife and beautiful daughter, Jillian Deom and Brynn Deom, and we're talking today about InfantSEE. We're here at our Hazleton office, 281 Airport Road, Hazel Township, PA. Telephone number 570-453-2020. And I also want to let you know about our brand new office in Tannersville. A beautiful location, big expansion, wonderful selection of frames, and that address is 2942 Route 611, Suite 5, Tannersville, Pennsylvania. Telephone number 570-421-3342. A great location, wonderful, extensive, really luxury line of frames up there in Tannersville. So if you're looking for some great new sunglasses or new frames, feel free to check them out. Really great location there. So we're back here with a beautiful little Brynn Leanne, and we're up to 6 months of vision development, and I have my fuzzy eyeballs on, so I'm ready to do a infant eye exam. And we're going to do a quick little infant eye exam, just kind of give you all an idea of what an infant eye exam does and why it's so important. In our last segment, we'll talk about, some of the other things that many infants do and parents do with their infants to check and see if they have any vision issues, and why it's so important that we do it this way. So this is a really comprehensive eye exam, and the first thing that I start with is this right here, the fuzzy eyeballs, and just being, sort of a comforting, but I think also exciting and boisterous character for children. Oftentimes, I think that sort of just loosens up the room, the children and the parents. A lot of times the parents are coming in with concerns, that they may have some concerns, but more often than not, what we would hope is that you would come in without any concerns. Just come in to learn about the vision development of your child, so we can educate you, for the long term. So some things to think about when you're coming in with your child to make this a really easy trip. So, right before you come in, something to do would be just make them as comfortable as possible. So let's get a new diaper on, nice new fresh diaper. That's a great idea, bringing them in. I would say, try and have a little snack on hand. As you can see, we have a little snack here, some crunchies and some yogurt melts, which Brynn absolutely loves, and they always kind of get her attention. Maybe have a bottle on hand, some water or some milk that would also keep them a little bit happy. And we're equipped with some little toys and treats, if you, the parent, is okay with allowing us to have some of that. Now on our side, once you've got them all ready, on our side, we're ready. Again, with the fuzzy eyeballs, and I have some other kind of toys and treats kind of keep the babies excited. So the first thing we're going to do, and one of the most common reasons parents come in, is because we're worried about eye alignment. And at this age, eye alignment is, at 6 months of age, eye alignment should be relatively stable. We should see that their eyes are aligned. And so what we like to do is we like to take a little pen light and take and flash out light at the child's eyes and get their attention. And then what we're looking at as we're doing that, you can see it only takes 2 seconds. We're looking at the reflection of light on the front of their eyes. And that's called the Hirschberg reflex. And we're able to measure where that Hirschberg reflex is on their eye in comparison to other structures on their eye. And that tells us if there's eye alignment. One of the biggest reasons for children children to come in with their parents is something called pseudoesotropia. Pseudoesotropia is where it looks like the child's eye is turned in, but in fact it is not. And the reason for that is because in this area right here, the bridge of the nose is not quite developed yet. And so we have excess skin in that area. Once that bone develops, it pulls that excess skin anteriorly, and then we don't have this extra flap of skin in this area, what we call the epicanthal fold. When a child looks to the left or to the right, and if that skin is still there because the bone is not developed properly, it gives the appearance that the child has an eye turn inward, something called esotropia, which could be a very serious condition if left untreated. So, if you are concerned about that, definitely bring your child in. Allow us to examine that. We can figure that out, though, with a very simple examination, again, with the light and the Hirschberg reflex, looking and making sure that they're seeing well. Okay, so that's thing number one. Thing number two that we're going to do is we're going to check their eyes' ability to move together as a team, all around, and then also converging and diverging. We do that with one of my favorite toys, and kids love this the most. We get it at a carnival. It's nothing special, but it moves and it's lights, and when you put this on, boy, do they pay attention. And you could see her eyes following it all over. She's not going to let that off her sight, and this is one of the things we want to make sure that as we bring it into them, they grasp for it. Perfect. Brynn, we practiced that ahead of time. Excellent job. So that's just showing me that they have good hand-eye control, that they're able to accurately place their hand where they want it to. And as they're doing this, I'm really closely watching the way their eyes are working together as a team. The other thing I want to do is kind of bring it in off to the side and see if she catches it. And she does, right? And she's able. So what I'm doing here is I'm checking her visual field, and I'm seeing, is she able to see in all different directions? So this is a quick, easy way to be able to assess her ability to see in her visual field. Very, very important. Her eye teaming, again, very, very important. The next thing we're going to do, and I think this is the coolest part of the whole exam because it allows me to determine if this child has a prescription. And I think so often people will say, well, how do you check a kid's eyes? They can't tell you what's better, one or two. And that's true, but most people don't know this. There's always an objective part to an eye exam. The subjective part, the one or two, is very important, but there's always an objective part. Right, Brynn? Yeah, that's right. So there's always an objective part to an eye exam. So this is the way we used to do checking of a prescription before we had all the fancy toys that we had. So what we do is we take this little flashlight and we just shine it near the child's eyes, and they'll grab it, and that's okay. And then maybe we'll grab another one so that we let them play with that. We could use this one instead, and they'll be quick. So as somebody who does a child's eyes, we just got to be quick and accurate. And so we've got lots of experience here at Hazleton Eye Specialists, so it's something we're very comfortable doing. And if you see, there's actually numbers around each one of these lenses here. And these numbers indicate the prescription of the power of whether or not this child needs glasses, okay? So we move these lenses over the child's eyes with the different powers, and as we're moving this light, we can see the light reflex change. This is something called retinoscopy. It takes 30 seconds to do, and it allows us to accurately determine if the child needs glasses. Now, a lot of times people will say, boy, that seems really young. Why would you prescribe glasses for a child at that age? And that's a great question. We're going to get into some of the reasons why. But what's important to know is we do have wonderful frames and lenses that are used that we can place onto a child's face that have straps in the back, and they're plastic and very comfortable and malleable so that they won't break. The next thing we're going to do is we're going to do a comprehensive examination of their internal and external eye health. And what we like to do for that is we like to put on this fancy toy, which is called a binocular indirect ophthalmoscope. We use this fancy lens, and we place dilating drops in the child's eyes, and we go and boop. And usually they're just so kind of into the whole thing that they're often better than most adults that I examine. So it takes all of 30 seconds, and by doing that, I'm able to accurately assess the child's front of their eye, inside of their eye, and the back of the eye, and make sure they don't have glaucoma, any retinal disease, or the most common form of childhood cancer, retinoblastoma, something that's been found many times by doing an InfantSEE exam. Again, we're here at Hazleton Eye Specialists, 281 Airport Road, telephone number 570-453-2020. And we also are at Tannersville, our brand new office in Tannersville, 2942 Route 611, Suite 5, Tannersville, Pennsylvania. The telephone number there is 570-421-3342, and you can find us on the internet at drkislin.com. Thanks. Hey everybody, it's Dr. Deom here at Hazleton Eye Specialists with my two favorite ladies, my beautiful wife, Jillian, and my beautiful little daughter, Brynn. And we're here today talking about InfantSEE, a wonderful free public health program for all of you out there to educate you about infant eye exams, infant development, and infant vision. We're here at Hazleton Eye Specialists, 281 Airport Road, Hazel Township, Pennsylvania. Telephone number 570-453-2020. Also want to let you know about our great, wonderful, beautiful new location in Tannersville, 2942 Route 611, Suite 5, Tannersville, Pennsylvania. Telephone number there is 570-421-3342. We're also available on the web at drkislin.com, so please check out our website anytime. So we're here in our last segment about InfantSEE, and a couple things I want to just make sure I communicate with everyone. So this is a free public health program aimed at educating parents about their child's vision and eye health development. So you may wonder why, you would want to do that and why it's important. Well, vision is really one of the main things that helps children develop their milestones throughout their life. So their motor skills, their gross motor skills, their fine motor skills, all has to do with their ability to see and perceive the world. So if they're unable to do that, some of those things could potentially be delayed. So some of the main things that we're looking for with this examination is a high prescription, either high farsightedness, high nearsightedness. So as I said earlier on, most children do have some prescription at this age. That doesn't mean we're going to prescribe it for them. So there is a level of prescription where it becomes visually significant, and taking care of that prescription will actually help them develop over time. They can actually have one prescription higher in one eye than the other, which is one of the most common reasons we would need to prescribe glasses, and that's something called anisometropia. And either a high prescription in both eyes or a high prescription in one eye can develop something called amblyopia. And amblyopia is the medical term for something that many of you probably have heard of before called lazy eye. And many, many, many lazy eyes, in fact, all lazy eyes, could really be avoided by getting children in early for this type of eye exam. If they get that correct vision from the eye to the brain early on, then many of them will not develop what we know of as lazy eye. So we look at this as senseless vision loss, and it really is vision loss when a child has one eye that's not seeing as good as the other. That brain-eye connection doesn't develop properly. And it's often until the later adolescent, even teenage years, when a child maybe gets a vision screening and they say, boy, you can't see out of the one eye. Let's go get an eye exam. It's at that time that we notice that this child may need glasses. So that's one of the biggest causes, biggest reasons we see that we actually need to intervene when it comes to an InfantSEE eye exam. One of the more uncommon reasons that we would have to intervene is in a very serious condition, something called retinoblastoma. Retinoblastoma is a childhood inherited eye cancer that it's uncommon. However, it's the most common form of childhood ocular cancer, retinoblastoma. So this is something that's been found many times by InfantSEE eye exams. Thank God I've not seen any cases of it here in this office, but it's something that, just knowing about it and its possibilities, it can only be found by doing a comprehensive eye exam is important, I think, worth doing. So you may say to yourself, well, That's all fine and good, Dr. Deom, but my pediatrician checked the child's eyes and they said their eyes are fine. Well, I'm actually very good friends with most of the pediatricians, if not all the pediatricians in this area, and we actively refer back and forth, and we're very proud to be one of the only pediatric eye care providers in the area. We love seeing children here, and I think we're well suited to do that. And even the local pediatricians admit their limitations in being able to find some of these really very important childhood visual issues. And really when it comes to a pediatrician's eye examination, it's, again, not a bad thing, but it's limited to, the flashlight, seeing about their eye alignment, and then moving the flashlight in front of their eyes, seeing how their eyes move, and that's the extent of it. Some will use a device to look inside the eye, but with limited experience in this, being able to look inside the eye, it's very difficult. And the device that we use, this binocular indirect ophthalmoscope, allows us to see the whole back of the eye, where the direct ophthalmoscope that a pediatrician uses is only going to see about 1/100th of what it is that we can see with this. So, for my child, I know, and the point of this conversation here today is to say that those eye exams just don't cut it. They don't cut the mustard. And after having conversations with a lot of pediatricians in our area, they also agree and actively send patients to us. So if you've not ever heard about InfantSEE and you're not concerned about your child's vision at all, but you just want to know more about eye and vision development starting at infant age, come on in. Give us a call. Free eye exam for children between the ages of 6 months and 1 year. If you are concerned about something with your child's vision, maybe an eye looks like it's turned in or out. Maybe they're not accurately grasping for things. Maybe they're not reaching some of the milestones that you feel like they should be reaching. Give us a call. Let us do this comprehensive eye exam with you here in our office. Beautiful office here in Hazleton and Tannersville. We're here at 281 Airport Road, Hazel Township, Pennsylvania. Telephone number is 570-453-2020. And in Tannersville at 2942 Route 611, Suite 5, Tannersville, Pennsylvania. The telephone number there is 570-421-3342. And we're on the internet at drkisland.com. I have to tell you, one of the most wonderful things in my life has been having this wonderful little blessing in our life. She's just the best thing that could have ever happened to us. And we do have the responsibility and sometimes unfortunate situation to deliver bad news to parents about children's vision. But getting them in early, finding out early, and allowing them to have the best opportunity to develop appropriately throughout the course of life is the #1 thing you could do to secure a bright future for your children. So get them in for a free comprehensive eye exam. Thank you very much. Have a great day.